Nurses Week, Maureen.
It is Nurses Week, and we have two here, Renee and Allie, and they represent the heart of Children's Wisconsin, where nursing goes above and beyond just your bedside care to form these lifelong bonds. So, ladies, welcome. Why don't you give us a little bit of a background? We'll start with you, Allie, because you were a patient and you actually were on the Miracle Marathon back in 2013. What happened then? How old were you? What were you a patient for?
So I was very familiar with children's, probably starting around 2010. I was diagnosed with acute lymphoblastic leukemia when I was 12. And then that's how I actually met Renee. She was my primary nurse up on the hot clinic. And so I was, the treatment lasted about 2.5 years. So I've seen Renee very, very, very regularly. And then I went through high school, went through college, decided I wanted to pursue nursing as a career. And so I graduated in 2020 from Carthage College. And then I started my nursing career at All Saints and Racine in their emergency department. And then I transferred over here, and now I'm a pediatric ER nurse over in the EDTC.
How long of an ordeal was the leukemia?
2.5 years was the full treatment time.
And you, Renee, are a pediatric oncology nurse? Is that where you spent your whole career?
All except for 1 year. It's been in pediatric oncology.
And Allie mentioned the hot clinic. What is that exactly? Why is it called that?
So the HOT clinic, it stands for Hematology Oncology Transplant, and they're the clinic side. So there's an inpatient unit and then an outpatient clinic where the patients come when they don't need their inpatient chemo infusions. And I worked on the HOT unit and then transitioned over to the outpatient clinic.
Okay, so then you guys kind of have a full circle moment here. Now, before we get to that, was it because of your experience at Children's as a patient that you decided you wanted to become a nurse, or was it just something you always wanted to do?
It definitely confirmed it. I have a lot of nursing role models in my family, my grandma, my uncle, my aunt. But then when I was going through treatment here, and just the unbelievable care that I got, that Renee gave, I was like, yep, this is it.
Okay, and then so to your full circle moment here, when you were treating Allie, you didn't have children.
No, actually, I have grown up at Children's Wisconsin. I was not married. I had no children. And I've been here for 25 years, so to see me through like my full life cycle.
And now you have children.
I do.
And lo and behold, one of those ends up in the ER.
Yes. He broke his wrist, and we came in, and it was change of shift, and it was during like the COVID, kind of like the post-COVID era where we were still like wearing masks. And a new nurse came in, and she's like, "Hi, my name's Allie. Is it okay if I'm your nurse?" And I looked at her, and I was like, "Of course it's okay if you're my nurse." And I couldn't think of anybody better to take care of my son than Allie.
Did you know she was a nurse here?
I did. I just didn't know it was just a twist of fate that she was working that night. Because we have kept in touch. Anytime she had an off-therapy visit, we would always kind of catch up and visit, and she would kind of fill me in as to where she was on her life journey. And so to watch that progression has been wonderful, and then to be receiving end of her care is truly special.
And what kind of job did Nurse Allie do with your son?
Beyond exceptional.
And you're both now, you're children's nurses, so tell us a little bit about what do you love about being a nurse here at Children's? You want to start, Allie?
Yeah, I all of the resources and all of the just like above and beyond care that we can give. I work PMs, so that's like 3 p.m. to 3 a.m., so I kind of see a little bit of the daytime versus the nighttime, and just all of the things that we are able to help families through, whether that's giving meal cards if people have any type of food scarcity, helping with car seats for rides home, knowing about all of the different things that I received when I was a patient here, and being able to share that with some of the families that come in through the ER, and hopefully giving them like a little hand in the tunnel. It's incredible, and there's just such a great team here, and I think Renee's life cycle here really speaks to that. Being here 25 years, there's not a lot of hospitals that can say that when it comes to employees.
You mentioned the 3 p.m. to 3 a.m. shift, 12 hours. You know, we've been doing 12-hour shifts on this marathon,
Yeah.
and it's grueling for
It
us.
is.
I can't imagine doing what you guys do for 3. Is that a normal shift for a nurse?
That is a normal shift. Usually it's 3 12s, lots of snacks.
Yeah, for sure. All right, and then Renee, same question. Tell us, since you, over the 25-year span here, what is your favorite part about being here?
The patients and their families. When I was in nursing school, I had always wanted to be a pediatric oncology nurse. I am unsure why, because I had no history with that. But watching these patients and their families walk through the darkest of times, and then to watch them come to this full circle moment is more than I ever thought that my nursing career would give me.
Yeah, you give hope, and hope becomes contagious, and it shows. And thank you guys for sharing your stories. Happy Mother's Day.
Thank you.
To you as well.
2 more great nurses on Nurses Week. This is awesome.
We're lucky to have you both.
That is the Miracle Marathon continues on 96.5 KLH.